At the New Jersey Vein and Vascular Center, we have the experience and the world's most advanced methods in medical technology to accurately diagnose varicose veins.
So a lot of patients present and they'll tell you they have varicose vein disease because they're seeing large veins in the legs, they're seeing spider veins, they're having symptoms, and oftentimes they are right. They do have something which is causing their symptoms. However, it's not always from varicose vein disease. So the only way you can diagnose varicose vein disease with any certainty is by performing a reflux ultrasound examination. This is done by an ultrasound technologist or physician. It is actually quite involved, and it takes in general about 30 to 45 minutes to diagnose it properly in patients. Physician experience matters in diagnosing varicose vein disease. When you're diagnosing varicose vein disease, you certainly don't want to overcall or undercall because that will lead to either overtreatment or undertreatment. So you want to properly treat the patient's symptoms, and the only way to properly do that is by doing an adequate ultrasound examination of the legs.
Dr. Miller will begin with a physical examination of your legs together with ultrasound imaging. The ultrasound images identify where the blood flow in your legs is functioning normally and where some veins may be compromised and require treatment.
So to do a proper ultrasound examination to diagnose varicose vein disease, it involves a physician and a technician's interplay to use the ultrasound examination to make sure that they do or do not have reflux of certain veins in the legs. In general, I would say probably 99% of imaging centers, hospitals, and technicians are not properly diagnosing varicose vein disease because it's a select subset of ultrasound which diagnoses varicose vein disease. So the general answer is you have to go to some sort of vein center to be properly diagnosed. So unfortunately, if you don't have proper equipment, properly trained technicians, and a physician who knows how to interpret the ultrasound examination, you'll be missing a lot of disease. You'll either be overcalling it or undercalling it, the so-called false negatives and false positives, and both have their own negatives about them. For instance, you don't want to be not treating somebody who has varicose vein disease, nor do we want to be treating anybody who does not have varicose vein disease. Veins provide an excellent conduit for flow of blood back to the heart, and if you're closing veins, which are normal veins or non-pathologic, that can get you in trouble down the road, and the patient certainly does not want that to happen.
At NJVVC, we pride ourselves not only on expert diagnosis, but setting up a personalized treatment plan for every patient. Complete the contact form on our website or call us now to schedule a consultation.